All right, in this segment we will do a short demonstration on basic massage strokes for the back of the shoulder. And in this case, we're going to work with a client who is female and who has on a tank top. So in order to work with that situation where there's clothes around the main area, we're not going to use any oil in this time. If your client was agreeable, you could apply a massage product or oil to do the strokes with, and obviously you'd be moving the tank top out of the way to do that. So I'll show you most of the strokes without oil and still just working around whatever clothing your client happens to have on. All right? So as always, we start with a bit of effleurage to the area. And for posterior shoulder, you could actually work the whole back, but I'm going to just show you a very spot sort of treatment around the posterior shoulder specifically. So I'm coming in alongside the vertebrae, up over the upper traps, around the posterior shoulder, down a little bit along the lats and the lateral side of the rib cage, and then back up. Using one direction here for effleurage in one hand, but certainly you could use two hands. And remember, effleurage is a superficial stroke. We're just getting the client used to our touch. If we were using a massage product, then we would be spreading it around as well. All right, that's perfectly great. And we'll move on now and do a little bit of palm kneading. So I'll show palm kneading just adjacent to the scapula. And remember, palm kneading is the stroke that has a circular component to it. We're coming up and around, pressure on the upper part, and then just gently bringing the stroke back down and around with very little pressure. And again, I'll just go back to my little starting position. With palm kneading, you can apply it in many different directions on the back. And it doesn't have to have just a one-directional sort of approach to it. Now I'm over top of the scapula area where infraspinatus and teres minor are, and again just using one hand, and we'll show the other hand as well. Bit of palm kneading, and this is fairly stationary, this application. Circular pressure part of the way through the stroke, layer pressure on the rest of the stroke, and a bit of effleurage in between. I'm going to go now to a little bit more specific stroke of fingertip kneading. So now this is the spine of the scapula here, and I'm going to start with a little bit of work up where the infraspinatus is. So circular pressure, part of the stroke. How's the pressure for you? Okay.
Thank you.
And we'll go all the way out to the greater tuberosity. And again, you can apply circular pressure, a little tight through there, hey?
Yes.
So just watching, this obviously is just more of a demonstration than treatment, but clearly that area that's quite tight we could spend a bit more time on. But for just now, we'll just do a bit of demonstrating. So again, I'm using hand over hand pressure for fingertip kneading, but there's no reason why you couldn't apply both hands and use fingertip kneading between the both. And as you know, I like to really encourage you to use your non-dominant hand as well. Give your dominant a rest. And of course, get some practice using that non-dominant hand for applying all the strokes, even by itself. They'll feel awkward at first, but with the practice, they'll continue to improve their skill. So this region was sort of all of infraspinatus and a little bit of teres minor and major out on the side. You could spend a lot more time all the way along the edge. That's a really good idea. But we'll move now up onto supraspinatus. So again, spine of the scapula, palpate its length so that you feel confident that you know where you're going. And then up into fingertip kneading, all along its length. And again, applying it in a way that works for your body. Generally, I wouldn't stand back in this position to apply it. I would be up here on the side. So again, I could reposition myself. And now in this case, you can see that I'm using thumbs to do kneading with as well. You could also add compressions. Remember, compression is simply applying some pressure, pausing for a moment, and then lifting out. Here I'm using thumbs that are reinforced, so my upper thumb is helping to apply some pressure right through to the lower thumb. You could also use fingers. In class, we will have covered trigger point work as well. So those stationary or held compressions could be applied in any of these regions, and you could be asking your client about if they had some tenderness in those spots, and you could spend some time and apply some pressure there. Again, better biomechanics would be to apply the pressure in a direct manner all the way along your joints. And there's different ways that you can position yourself to do that. I'm going to move now into a bit of picking up, a bit of a broader stroke now into the upper traps area. And I'm just going to move this to the side if that's okay. And now we can get a little bit of work directly on the tissues, the muscles in that region. Picking up is a really great stroke for upper traps. You can get all the way out to the spine of the scapula and a little bit of a lift in front from off of the clavicle. You do have to use a bit of checking in because this is an area that often has a lot of tightness and can have quite a bit of tenderness as a result. So good picking up. Clearly, if there was trigger points in that area, you could use a pincer palpation. Right, so you're squeezing between both the fingers and the thumb and applying pressure that way, or you could apply direct thumb pressure or reinforced pressure with both hands. Again, using your biomechanics to the best ability that you can, so that your body is as well positioned as possible. Now I'm doing some fingertip kneading along the paraspinals, splenius cervicus region, all of those posterior longer muscles, it's through sort of that C6, C7 area. I'm drawing the tissues away. How's that feeling for you?
Very good, thank you.
Great. And again, obviously I would have informed the client that I'll be moving their tank top or bra straps around a little bit to position and get down. And clearly I could work just over the clothes and work a little bit further down as well. So this is a little bit more specific, deeper type of finger kneading and whatnot. You could again get the palm in there and do a little bit of circular kneading, or again even compressions, right? Using the hypothenar eminence and your pisiform. A little bit of compression work in through there as well too. All right, and of course a bit of effleurage over top. The last thing that we'll show just for some basic things on the back is I'm going to move your arm down to the side, and let's just flip it that way. Perfect. Reposition your clothes there. So this last stroke that I'll show on screen is going to be a bit of a lift for the scapula. You can actually position the arm right behind the person's back. On camera it's not really showing where the hand would be. It would be down at the lower back region. But I'll show you this way as well to do it. So you're going to use a very soft hand, gentle scoop underneath. So my hand here that's on the table is going to do a bit of a lift. So I'm actually kind of retracting the scapula here. And the other hand, and I'll just get you, let your shoulder relax as much as possible. Awesome, that's great. And the other hand is going to come in with a fairly flat surface. And I'm going to apply a bit of pressure, aiming to get slightly underneath the shoulder blade. So let me know if this is too intense. And you can see I can get a bit of a lift down at the lower end. And as we would work that, you can usually get a little bit more of a lift and get in and underneath that medial border of the shoulder blade. If the arm was behind the person's back, you can get a bit more of a lift as well too. And we'll let that down softly. And then of course just a bit of effleurage to finish. And that's a few techniques showing the posterior shoulder.